One of the great things about travel health is that it does overlap with so many other specialities. So it's a pleasure to be here at today's Migrant Health Day to talk about travel health. In particular, in the next 15 minutes or so, I'm going to be talking about travellers who are visiting friends and relatives. Let's start off then with what do we mean by VFR, visiting friends and relatives? And it becomes very quickly evident when you look at the literature that there is no accepted definition of exactly what a VFR is. At the most basic level, all it is just a description of why someone is travelling. It's a reason for travel. And here we can see myself and my husband, in fact, being a VFR. And it just so happens that my husband's family live in Port Elizabeth in South Africa, and this was us being VFRs, visiting family and friends. This was my wedding day, so I hope you can forgive the big cheesy grin on my face. But of course, this is not who we refer to when we think about VFRs in travel health. What we really mean is first or subsequent generation migrants who are resident in the UK and travel abroad for the reason of visiting friends or relatives in either their or their family's country of origin. So how many people are travelling for the reason of visiting friends and relatives from the UK? Well, the easy answer is an awful lot. This is data from the Office for National Statistics, it's travel trends, and from 1991 through to 2011, this shows the reasons for travel made by UK residents. Holiday travel, tourism, has always been the most popular reason for overseas visits, followed by business until 2003, when it was actually visiting friends and relatives that overtook business as a reason for travel. And that's a position that VFR travel has maintained ever since. So if we tease out those numbers of people visiting friends and relatives, again, data from the Office of National Statistics, 2003 to 2011, with a few blips along the way, the trend is basically upwards. There are an awful lot of people travelling overseas to visit their friends and relatives. Of course, some of these travellers will be people like myself, travelling to relatively risk-free destinations, but of course within these are also going to be our migrant populations who are travelling back to their or their family's country of origins, where their risk profile is very significant. So why are we so concerned about VFRs? Well, lots of reasons. Their risks are very much increased, and I've just picked out some major risk areas, really. The first of which is enteric fever. So included in this is typhoid, paratyphoid and typhoid. This is data from the Health Protection Agency, and these are laboratory-confirmed cases of enteric fever by reason for travel, and this is the first quarter of this year, 2012. So numbers were 92. What we're really focusing on here is that huge, great blue chunk there, because 81 of those 92 cases were in travellers who were visiting friends and relatives, whereas in relation to that, very small numbers of people, holiday travel, foreign visitors to the UK, or new entrants to the UK. But it's really that 81 cases there that is so very dramatic and so very worrying. And this is not just a one-off. You know, if we look at the Health Protection Agency's enhanced surveillance data, and this is from 2007 to 2010, they highlighted 1,671 cases of enteric fever, and where a travel history was available, 83% were VFRs. So again, this is a really shocking statistic. And something that is concerning to us in travel health and anyone who's caring for migrant travellers. Not just typhoid, set up very nicely by the last speaker, so I will talk a little bit about malaria. Not so much about the ins and outs of malaria, but basically, again, it's numbers, it's figures, and again, it's very worrying, concerning, shocking figures. And again, this is data relating to cases of imported malaria in travellers returning to the UK. And this is data for last year, 2011. And you can see we had a total of 1,677 cases of malaria. And that top line there, 610 of those were in travellers visiting friends and relatives. And if we compare that to the next line down, 68 in holiday travellers. You will also see, not stated, we had no travel history for a huge number of cases here, 599. So, of course, it's very likely that mixed in with those 599 would again be people visiting friends and relatives. But again, very huge, very worrying figures, which unfortunately means that we are prompted on the NATHNAC website to publish regular updates about malaria and the risk of malaria in travellers returning to the UK. And again, this is one such posting from April of 2012 when that data was published. Again, just highlighting the huge number of cases in travellers visiting friends and relatives. And the fact that an awful lot of those, the vast majority of those, were not taking malaria chemoprophylaxis, or they were taking inappropriately prescribed or recommended malaria prophylaxis. So basically malaria prophylaxis that was not appropriate for their destination. We have very, very good data, surveillance data, certainly in comparison to other countries. We're very lucky in terms of typhoid and malaria and risks in VFR travellers. We don't have such good data, but certainly there is data out there suggesting that other disease risks, including hepatitis A, influenza, tuberculosis, HIV and sexually transmitted infections, all have a higher rate in travellers visiting friends and relatives. And of course, many of these topics have been covered during today's proceedings. So why? Why are we seeing this big difference and this big disparity really with the risks in VFR travellers? The data, again, is surprisingly rather lacking. For a huge issue in travel health, there is not an awful lot of really good data out there, but certainly the data that is out there, and in some cases reasonable assumptions, we can say that our travellers who are visiting friends and relatives are generally going to higher risk destinations. When they're there, they're generally staying for longer periods of time. So these are not your 2-week holiday travellers. These are people who tend to invest a lot of time in their trips back home, and they're often staying for many weeks or several months. They're going, of course, the very reason of their travel is that because they're staying within their family or their friend's home. So their standard of accommodation is often very, very different to our tourist holiday makers. More social mixing, it could be the reason that's maybe what's prompted their visit home. Perhaps a family member is getting married, etc. And our VFR travellers tend to travel far more rurally as well. Essentially, when they do travel, they're becoming members of the local population, and so their risk profile is very, very different to that of a tourist-type traveller. However, we've also found that there is a lower rate of seeking travel health advice. Travellers, full stop, are not terribly good at seeking travel advice, and I'm sure you can all testify to that in your own practice. I see nodding heads there, but certainly that seems to be a big issue with travellers visiting friends and relatives as well. And also, they tend to be less compliant. I mean, again, travellers generally are not terribly compliant with any travel health interventions or advice, but certainly that does seem to be the case with travellers visiting friends and relatives. Very often, VFR travellers are aware that there are risks associated with their travel, but the major difference here is that they have a different perception of those risks. So their perception is very different. Perhaps they think that malaria is a very non-serious illness. And sometimes we maybe unwittingly sort of encourage that sort of thinking. Sometimes we might describe malaria as being a flu-like illness. You know, look out for flu-like symptoms. A lot of people can't differentiate between a common cold and flu. And so you may start thinking, well, malaria is nothing much to worry about. It's a bit like having a cold. And of course, you and I know that it's a very serious, life-threatening illness. So what can we do about this? How can we make inroads into this and really start to make a difference? Well, I guess the major message is that we take every opportunity to ask about travel plans, and this is a message that I've already heard come through with other speakers today, is that not just a focused travel health consultation, any consultation, take that opportunity to ask about visits back home. So that might be new patient checks, it might be baby clinics, it might be asthma clinics, your diabetes clinics. All of your migrant registered patients, ask them whether or not they're planning to travel. It is about being respectful to perceptions and beliefs. And it's not sort of poo-pooing this, oh, well, you know, malaria is a non-serious illness. Everybody gets malaria, that's just the way it is. I'm immune to malaria is quite often, you know, oh, that doesn't affect me. My family don't take anti-malarials, there is no risk for me. So it's being respectful of that, but it's also trying to tactfully correct those misconceptions as well. And one of the major hurdles is trying to get VFR travellers into your surgeries, into your clinics in the first place. And once you've got them there, this is your opportunity to make sure that you tailor that individual advice to your individual traveller, and you make it achievable and you make it appropriate to them. There are lots of sources of information out there, and this is taken from the Health Protection Agency website, and this is typhoid. It's health advice for travellers about typhoid, and this is available in several South Asian languages there. So perhaps, you know, we've had a session about using interpreters. It's making sure that information is available where English is maybe a second language. So I mentioned that major hurdle of getting travellers to your pre-travel health consultations in the first place, and several ways perhaps to think about doing this: making contact with the local community, sort of churches and other places of worship, maybe trying to involve and engage with community leaders, community centres. Schools is a good place to start. I've heard of really good programmes in the States where people went in and talked to school children in school. The idea being, of course, is that those school kids then went home and pestered and nagged their mum and dad and said, you know, when we go on our trip, we need to take malaria tablets. This is really important. And so sort of working downwards and working upwards, if you like. Travel agents as well. There are lots of travel agents out there that specialise in migrant travel. And maybe it's targeting those as well, asking if you can put leaflets in travel agencies, offices, etc. It's also being alert to your returning travellers as well. Be alert to illness in returning travellers. So it is always, always, always taking a travel history from anyone who presents unwell with a recent history of travel. And we've already heard this today, but anyone who's unwell with a fever, it's malaria until proven otherwise. When you're requesting any lab tests, always include a full history so that lab technician knows what they're dealing with or potentially what they could be dealing with. And appropriate testing as well, appropriate reporting of travel-related illness as well. We're never going to get really good data on illness in returning travellers without you guys reporting it in the first place. Perhaps before I talk about that, I know I did not include cost, finances, as a barrier. That's not because I don't think it is. It is a barrier in some cases. And as already been highlighted in the last session, anti-malarials, to give an example, are very expensive. There has been a little bit of work done on finances, and I know the question was about how much does it cost to treat a returning traveller with malaria compared to how much does it cost to fund their anti-malarials. I think Ron Berens, who's a consultant at the Hospital for Tropical Diseases, has done an awful lot of work about this and an awful lot of work and research into VFRs as a whole. I think, like anything, prevention is always better than cure. You are probably aware that there are 3 London boroughs where you are actually able to prescribe antimalarials on NHS prescriptions. Ron has done a little bit, I know he did do one study looking at whether or not that had made much of a difference. I can't admit to being totally au fait with that study, but I think the general feeling was it hasn't made too much of a difference, which begs the question, there may be something else going on here? Perhaps it's all of those other reasons that I've talked about. But certainly not to be downplayed, and the reason I didn't sort of specifically put it on a slide is because I have no answers for you, I'm afraid. Antimalarials are expensive. It's going to take something on high, I'm afraid, to change that. If you are particularly interested in seeing more of me, again, I can point you, as we have along the way, to the Migrant Health Guide on the Health Protection Agency website, and there is a section there on VFRs and a little video clip that was recorded by yours truly. Oh, that's embarrassing, I'm wearing the same T-shirt. And thank you very much. It was just a very brief touching the surface of VFR travellers, but of course I'm happy to take any questions.